Hello, health enthusiasts, and welcome to Rev Up Health, your go-to podcast for all things wellness. I'm Dr. Mark Hechler.
And I'm Tandi Hechler. Together, we're here to fuel your health journey with the best of functional medicine and holistic well-being.
Each episode will dive deep into topics that matter to your health, bringing you the latest insights, research, and inspiring stories.
So whether you're on a quest for vibrant health or just looking for daily health tips, we've got you covered.
So let's embark on this journey together and transform the way you live. So Tandi, what's on our wellness radar for today?
Hello, and welcome. We are so glad you're here. Today, we want to take a minute to talk about thyroid. It's one of those things that comes up a lot in all areas. It's a really big topic, so we might not even be able to hit everything that we want to address today, or there may be questions, in which case you guys let us know. Type the questions in the comments and we'll get back to that. But for now, let's get educated on thyroid.
Hi, Dr. Mark here. So basically, what's the thyroid do? This thyroid gland is a gland that does a lot of things. It's a multitude of things. So you may have had symptoms, for instance, you may have gone to your doctor and said, I'm fatigued, or losing my hair, or I'm just excessively hot, or I'm always cold, things along that line. The doctor may draw some labs on you and say, well, everything's normal, so I can't be your thyroid. Well, we beg to differ on that situation. So today we hope to kind of educate you on a little bit more what the thyroid does, and your symptoms potentially could be thyroid related. So let's get started. First, your thyroid is basically just a gland that, in an overall nutshell, just regulates metabolism. There's a lot of things it does. It affects a lot of glands. It affects all the cells of your body. And so that tends to cause a lot of regulation and dysregulation that can occur, which can result in various different types of symptoms that you can have too. And it affects your growth and development, your heart rate. It affects your muscles, your strength, as well as your digestion, even brain development. Of course, your body temperature, whether you're hot or cold, sometimes can be thyroid regulated. Cholesterol levels affect that, as well as in women, it can affect your menstrual cycle through estrogen and progesterone. So there's several things that your thyroid does. For the metabolism, it can affect your weight. You can have weight gain and loss too. So, basically your metabolic rate just controls how much calories that you do for just sitting around, breathing, sleeping, thinking, and just digesting. So it affects that. Hair growth. Obviously hair growth is one of those things which other hormones that affect hair growth, but that could potentially be the quality and texture and thinness of your hair could be affected by your thyroid function too. Obviously other influences for hair loss, could be simply low iron, and even estrogen deficiency and menopause causes that too. So energy levels are very subjective. And so at this point, if you feel like you have midday crashes or need a cup of coffee for various different reasons, well, maybe it could be your thyroid. Thyroid hormones help to regulate your energy of your mitochondria with certain enzymes that they take place. So the enzymes in the mitochondria can affect your metabolism too. But something that people don't realize is that your thyroid can affect also your estrogen and progesterone levels, even cortisol levels. So it affects a lot of different things. And even a low testosterone level could be caused from low thyroid hormone. Menstrual cycle irregularities, that could be related to low thyroid hormone. Your mood, your thyroid regulates your mood too. So depression or anxiety can even be an outward symptom of altered dysregulation in thyroid. So, an inability to focus on or concentrate. Brain fog is what we say. So that's certainly something that can be related to alteration in thyroid.
So another thing that's interesting is that obviously these types of things have been an issue for a long time, but why is thyroid becoming, so I think it's something that has been an issue. It's just been there's been a transition in it recently. And I think it's really important to talk about why the thyroid is having so much dysregulation now. And I think that has a lot to do with the endocrine disruptors that we come in contact with so much more today.
Yeah, right, Tandi. That's true. I mean, there's certain things like various different toxins and things what I call 3Ps, pollution, plastics, and processed food. These things affect the way that the receptors even work on all the cells. I mean, all of your cells will basically respond to thyroid hormone. And so when these are disrupted, these receptors are blocked or disrupted. Things like smoking and alcohol will even affect it too. When they're blocked, you're going to have trouble with processing the thyroid hormone in your system. So this is the reason why you may have a normal thyroid level, but yet you're hypofunctioning in your thyroid output.
I think that's a really good point and a good time to talk about the fact that typically when you go to your traditional doc and you say, I want to look at my thyroid, or I think this might be an issue, I would say probably 80% of the time, they're only going to draw a TSH. And there's so much more that we need to look at when we're looking at thyroid function than a TSH. Can you tell us a little bit more about that?
Yeah, of course. But basically, there are several different levels of testing that can be done. Yes, TSH is the most basic and actually somewhat of one of the only labs. Sometimes and even insurance will even pay for because of cost containment. But you need to look at the T4, your total T3 and free T3s, and then there are thyroid antibodies which can tell you more information about inflammatory autoimmune disorders of the thyroid, and those things can either cause you to have overactive or underactive thyroid function too. And then in the future, those types of autoimmune conditions can lead to hypothyroidism. So it's a long, slow process sometimes when that occurs, but that can happen. But these antibodies are such that hardly ever does anyone get those drawn. And you can kind of tell too on an exam, a physical exam, you can feel the firmness to the thyroid, which kind of indicates to me that someone may have a thyroid inflammatory process going on. And that's where we draw those extra labs.
That is something in our current integrative practice, we're looking at all of those things because similarly to some of the other things that we've talked about, if you can look at the levels of certain things that would get dysregulated or abnormal first, that then would change the way the TSH comes through, that's the best thing. Because if you can look at that and define that, then you can keep that TSH from going the wrong way. Tell us a little bit about T4 and T3 and how that works.
Yeah, so basically you've got two hormones that are basically secreted and produced and transformed, if you will, within the body. Thyroid is a pretty complicated gland. So you've got T4 and T3. The T4, it gets produced, but it gets converted into the active form, which is T3. And the active form is the form that what your cells see and use to produce the metabolism and all the regulations that occur within your system. So if we're not looking at our free T3 and total T3 levels, then we don't really know how our system is adapting to those levels of thyroid. And when we start looking at the lab values of the thyroid too, the average indicators, if you will, normal ranges can be a given grouping of population of the community, of the people that have their thyroid labs drawn. And so what will happen is you'll have folks in a range of normal, which only takes a standard bell curve, if you will, of everybody that gets blood work drawn. So you've got all the metabolically dysfunctional people that will have the labs drawn, and this is where they fall. Well, it doesn't tell you the true picture of how they're functioning, how the thyroid is actually functioning, or how the cells are functioning related to that thyroid. So we need to look at that. We like to have folks higher side of normal with the free T3s, and that's usually a good place to kind of start for some folks that may have a feeling of fatigue or general weak or tired weight gain problems. So that's what we'll typically see.
So as we're talking about T4 and T3, I think another just comparison to talk about traditional medicine, kind of how we're a little bit different. One of the things that you'll notice is that when folks have a thyroid issue, they'll frequently be put on level, which is T4. So that's just T4, the kind of inactive part of your thyroid hormone that then your body still has to convert from T4 to T3. So one of the things that we do differently is we replace both T4 and T3. And you can do that with a bioidentical hormone replacement with desiccated thyroid, or they also have pharmaceutical, the T3 separately in a synthetic form as well. Do you have any more thoughts on that?
Yeah, it's almost imperative that you have to replace thyroid hormone with some T3. Whether you add a separate medication or you do the combination medications like you spoke of. Arbor and NP thyroid are very good classic examples, those that you can get at traditional pharmacists. These micronized thyroid pharmaceuticals that are created are more bioidentical, so your system is going to like those and it's going to use those better. So we also look at the antibodies to see, okay, well, is this something in the future that you're going to have trouble with, the elevations, decreases in your thyroid, or you're going to have to change your thyroid supplementation. So, but in general, you may have people that have these endocrine disrupting situations. They may just need to be on a higher level or on thyroid in general. You may be normal, but you just need to be on thyroid replacement to be able to function or feel more natural. And then you can work on, well, let's see, what else am I doing to these toxins within my system? What do I need to do to detox myself? So there's a lot of things we can work with on that. Some of the things that we can do for supplementation for folks too, outside of just taking thyroid. Look at your zinc. Zinc, iodine levels are good to have. Vitamin D. So, but also it goes, you don't have to take something. It can be something as simple as getting exercise. Doing a certain amount of exercise a day that will help your thyroid work better. Getting good sleep. Obviously 7 or 8 hours of sleep a day will help your whole system kind of reset, make it easier for your endocrine system to kind of be more optimal. And also, one thing that's very important is gut health. If your gut's not healthy, then you're not going to absorb things no matter what you take. So you really got to look at that. And gut is becoming more and more a system that needs to be optimized and have attention. And that's something that leads back to all the processed foods and the 3 Ps I spoke about previously. The processed foods and all the toxins in our system and our ground water and our dirt, everything, and basically what our animals are eating, all this, we're eating that stuff. So that it gets into our system.
One other thing that I just wanted to mention really quick that has been interesting as we're looking at research and different studies is depression and anxiety, and how they've actually used desiccated thyroid to treat non-responsive depression and had a lot of luck there. So it's just fascinating to me, all the things that the thyroid does, and it's pretty interesting to know that that all of these things are so related, and happy that folks are finally looking at, the root cause of why some of these things are happening and why these, we're just so dysregulated.
Yeah, the key is finding out the root cause of all this. You may feel fatigue, you may have all these other symptoms of hypo or even hyper. Why? Get to that root cause of that so that you can be to a point where you can maybe not have to take replacements or supplements, or, you can do some basic things to try to improve your own health and your quality of health.
I think that is so key. So often we get to a point where our body is just not able to allow us to do the things that we know we should do, the activity that we need to be doing. I guess it's not really motivation, but we get in a state where we just don't feel like we can do the things that we need to do. And supplements and pharmaceuticals can give us a chance to get to a place where we can't start to do those things. I always say, like, medication is great when you need it, and there are always times that you need it. They're not always, but frequently there are times when you need medication. Even talking about high blood pressure or something like that, where you can treat the high blood pressure when you're in, and then treating that blood pressure allows you to get to a point where you can do the things like diet and exercise so that then you don't need that medication anymore. I mean, that's the goal, is to get that body back to a steady state where it doesn't need those things.
So basically, in a nutshell, kind of wrap this up, need to really kind of see what symptoms do I have. Are these symptoms potentially related to thyroid function? And I say function because it doesn't necessarily mean that your labs dictate that you're normal. So if we have to convey anything to you, don't rely upon your labs to tell you that you're normal. You may not be. You may be suboptimal. And at this point, there's things that need to be looked into to try to improve. We can actually correct the dysregulation that's going on in your system. But, check out the symptoms, see what's going on, do your own education, get yourself informed. And I would suggest to try to do this on your own, because you can't necessarily rely on anybody else to help you out with this. We're happy to help you, of course, and here at Revelation Health and Wellbeing, you can contact us, ask us questions. If you have concerns, shoot something to us by email or Instagram. We're happy to help and hope to see you on the healthy side.
Thank you for tuning in to another episode of Rev Up Health. We hope you're leaving with some valuable insights to supercharge your health journey.
Don't forget to follow or subscribe to Rev Up Health wherever you listen to your podcasts. And if you enjoyed today's episode, please leave us a rating and review.
Have a topic you want us to explore? Reach out to us on social media channels. We love hearing from our wellness community.
Until next time, keep thriving, and remember, your journey to health is a journey to a better you.
Stay well, and we'll connect with you again soon. This is Tandi.
And this is Dr. Mark, signing off from Rev Up Health. Take care.
The information provided in this podcast is for educational purposes only and is not intended as medical advice. The content is designed to support, not replace, the relationship that exists between a patient and their healthcare provider. Always consult with a qualified healthcare professional before making any changes to your healthcare regimen, including diet, exercise, or treatment plans. The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of Revelation Health and Wellbeing.